The Families First Coronavirus Response Act includes enhanced Medicaid matching rates for states. Now, the main part of the Response Act is the increased access to coronavirus testing, along with enhanced sick leave benefits, emergency paid leave benefits, and mandated health coverage. But what has state Medicaid directors particularly enthused is that enhanced federal matching rate coming in to help support state Medicaid programs. Now, the term is called Enhanced FMAP, and FMAP stands for Federal Medical Assistance Percentage. As you may know, Medicaid is a federal-state partnership. The state and federal government share the cost of the program. The federal government's portion is to pay the states a specified percentage of program expenditures. Now, that percentage is what is being enhanced by this legislation. Of course, the state has to show that it can fund its own portion of the share of the cost, but the federal government will increase what they are contributing to the tune of 6.2%. Which is a very large increase in that FMAP, in that percentage of federal share. But it's only for the duration of the emergency, and states have to follow specific guidelines. If they're going to keep getting that enhanced matching rate, they have to follow 4 general rules. The first of which being they can't change their eligibility standards, methodologies, or procedures for their Medicaid program. It can't be more restrictive during the emergency than what the state would have had on the books as of January 1st, 2020. So no new adding of requirements like work requirements in the Medicaid program. If they weren't in effect before January 1st, 2020, they can't be in effect during the emergency if the state wants that enhanced reimbursement. Now, also, no new premiums. A state Medicaid program can't add premiums or increase the dollar amount of premiums on the books during the duration of the emergency. Also, and very importantly, the state cannot terminate anyone from the Medicaid program unless that individual specifically asked to be removed, or if they no longer meet the state's residency requirement for Medicaid. If they move out of state, then the state can drop them from the Medicaid rolls. But to get that enhanced FMAP, the state must keep all Medicaid enrollees intact, even if they would be leaving for some other eligibility purpose. And that is huge. That maintains the eligibility of individuals for health coverage for the duration of the emergency. Now, the last requirement that states have to follow in order to get that enhanced FMAP is to not add any cost sharing for any testing services or treatment for COVID-19, the coronavirus. And this includes vaccines if they become available, specialized equipment, and therapies. So those are the 4 requirements on the books for state Medicaid programs to follow if they want to get that enhanced FMAP, that Medicaid federal participation match coming from the federal government for the duration of the coronavirus emergency. Now, we link in the description below to the Families First Coronavirus Response Act. It is long. If you are looking specifically for the Medicaid language that we're talking about today, you will look at section 6008. You can find that in the description below.